Welcome back to Technique Tuesday. My name is Dr. Nick with Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today I'm going to show you a really easy ankle mobilization that's going to be helpful for you folks who are having difficulty with squatting, whether that's getting down into a chair or hiking and feeling like your ankles are really stiff and you're having to use your knees a lot. Ankle mobility is hugely important to maintain balance and going forward, taking care of any knee pain or arthritis. So stay tuned. So ankle dorsiflexion is a very important movement of the ankle, and that's where we want to have the foot be able to get closer to our shin. So Colton's going to lean forward. It closes this angle here of the ankle. So how do you know if you have a stiff ankle or difficulty with dorsiflexion? Simple test is you get down in front of a wall and you want to do palm width away. So just take your hand, get it palm width away from the wall, put your toes right at the end of your hand, and then you should be able to bend your knee towards the wall without getting your heel off the floor. So he's a little bit tight. Nothing too crazy, but a little bit tight. And so this mobilization technique is going to be really helpful for Colton to be able to increase that movement. So what you're going to need to get at home, this could be a chair or a stool that's sturdy. And then this is any kind of exercise band that could be moderately tight, doesn't be too crazy. And you can anchor it into a door or door frame right here, or if you have a rig at home, against a rig. With this band, is going to stay right down at the far end of the tibia. The tibia is a shin bone that goes all the way down, and it's what sits on top of the ankle joint. There's a bone right here inside. This bone comes down and kind of forms this upside down U, and there's an ankle bone called the talus that sits underneath. And so this band's going to sit right over top of that joint space. So as Colton leans forward, it's going to help to pull that tibia back. And as it pulls back, it's going to put some pressure on the Achilles and help to stretch out and mobilize the backside of the ankle, which is what's restricting that foot from going into more dorsiflexion, more ankle bend, toes going to shin. Again, why this is so important is that it's going to help with knee motion, mobility, so getting up and down out of deep seats or chairs, squatting mobility. When you're out hiking and having to go up on steps, it's going to significantly improve all that ability to take pressure off of your knee. The way to do this correctly, he's going to lean forward, he's going to scoop in and then go all the way out. You're going to notice as you go out, it's going to be a little bit stickier, a little bit more restricted. So feel free to spend a little bit more time there. I like to do a 3 to 5 second hold, particularly on the outside, going knee outside of big toe. If we use our big toe as a space of orientation, we want to think about bringing our knee out to like the second, third, and fourth toe. 3 to 5 seconds. Repeat that 10 to 15 times. 3 to 4 times a week should significantly improve your ankle mobility. Doesn't take very long. Think about it as a 3 to 5 minute ordeal in total setup time. Very easy to do, very easy to warm up prior to squatting and doing any kind of exercise in the gym. Now you know how to test if you have stiff ankles and what you can do about it to help on your own. If you have any questions, give us a call. We'd love to help. Keep an eye out for more Technique Tuesday videos to help you stay active and independent and avoid surgery.